Good evening, everyone, and welcome to tonight's webinar. Do telehealth, but also can do other aspects like electronic prescribing. And there is a dedicated telehealth email if you would either like to get a clinic set up, if you haven't already, and you watch this tonight and you go, that's what I need one of these. You can email straight to telehealth@cesphn.com.au. If you've got any questions, you can also email us there. Or if you already know who your digital health support officer is, you can email them directly, however you wish, but that's all our contacts there. So just very briefly, in terms of telehealth, this has become a big part of our work ever since COVID kind of hit, I guess. In March 2020, the government introduced a suite of temporary COVID-19 telehealth items, MBS items, a lot for GPs, but there also are quite a number for allied health professionals and around mental health and around team care arrangements. Since that first initial setup of the numbers in March, there's been lots of different changes. The most recent occurred at the beginning of July, and those changes in July pushed a bit more emphasis onto video conferencing. So where previously there was telephone numbers and video numbers for pretty much all aspects of telehealth, now there's less telephone numbers and more, well, all the video ones have remained in place that were there. So it's definitely worth doing video, not just for the MBS item numbers, but because of the better kind of standard of care, I guess, that you can give to your patients when you can actually see them and your rapport and everything. But if you're interested in knowing about the changes to the item numbers, the link there is straight to the MBS online page. I would say just check on that because they do change it really often. The first one of these webinars we did, they changed it on the day that we did the webinar, so that was a bit difficult. So yeah, best to keep an eye on that rather than kind of anything that might be a little bit out of date. So now I'm going to hand over to Jude Cobb, who is the Video Call Customer Engagement Officer from Healthdirect Australia, and she's going to talk to us about how we can get this set up, how it works. We're going to do a little demo between us of what it looks like, the interface. And then, of course, Jude can answer all of your questions, or hopefully can answer all of our questions as we go along. So thanks.
Okay, so yes, my name's Jude Cobb, Video Call Customer Engagement Officer. I really work as part of the support team as well, answering any questions, setting up clinics, and I'm going to go through an overview at the beginning and let you know what Healthdirect Video Call is. If you haven't used it before, some people may have used it. I'm not sure what the split is tonight. And then I'm going to do a demonstration and we can go through. So please, yes, ask any questions because other people may be wondering the same thing. So it's really good to get your questions, and it's really good to keep it interactive in the sense of if questions are coming in, we can actually stop. I'm happy to stop at the time, Nerida, if that makes sense. If I'm on a screen that someone's asking a question about, that's probably a good spot.
Okay, no worries. I'll keep an eye out.
I've just said that. I'll just go through it so that we don't take up too much time. So I'm just going to go through an overview, set up support. I'll tell you about our resource centre and then go through, and we'll have time at the end for questions, but during questions, during the time as well. So just the very first slide, I don't know if you can see that little overlay of Zoom over the top. I don't think so. I'm just going to move it. There we go. Okay, so Healthdirect Video Call, purpose-built for health, for video consultations for health. So that's exactly what we were set up to do. Been in operation since 2014, just so you know, so 7 years. Developed for Healthdirect Australia's telephone helpline, so our after hours GP line and our pregnancy, birth and baby initially, and also primary and tertiary care. So, and we've got, you know, just these little points down the side here. A lot of people ask us about security, privacy, and all of that. So I'm going to talk about that today in the next slide, I think. And the flexibility, so we can help you set up as you currently sort of have your workflows. We can sort of replicate those and help you work out your workflows in video call as well, because it's very flexible. So on the right here, what this is meant to just show is this, it's a platform. It's a video, you know, conferencing type platform, but it is, you don't need any apps or anything like that. It is browser based only. So you open up an internet browser and you directly connect with the people once you join a video call with somebody. It's a direct peer-to-peer connection. So there's nothing else in the way. There's no other third-party kind of software or anything else like that. So it's very secure. Everything's encrypted. That's the platform part. On the top of that, we've got our management console, which is where you kind of go in and you can set up your clinics. You can go in and brand if you want to. You can go in and set your operating hours. There's all of the kind of the management side of things. So that's on top of the actual platform where you can join a video call. And on top of that, we've got our resource center, which I'll just show a quick screen grab of afterwards. So we've got a comprehensive resource center library that we keep updated that just lets you know everything about video call, really searchable, and our expertise to support you. And we do a lot of support, onboarding, anything really. We've got like a line which is 8 a.m. to 6 p.m. So a phone line that we answer. And we've also got basically a service desk. So if you email us, it comes through. There's a little ticketing system and we work with people on whatever either issues or any questions that you have. So that's a little bit about, oh, my slide's not changing, about the services, a very high level overview. Some of these are a little bit the same, but just to let you know, it's a virtual waiting area dashboard. So when you're using video call, you have a clinic link. Each clinic has its own link that's used for all patients, and they come in to a waiting area. Rather than you calling people, you send them their patient information, they click on the link, they come in and you join them, just like you would in a physical clinic. And as I said, there's no special equipment or software downloads required. You can do it on any device as long as you've got an internet browser, an internet connection of, you know, that can be Wi-Fi, 4G, Ethernet, whatever it is. And obviously a camera and a microphone so people can see and hear you. So you can do it on a phone, a tablet, or a computer. Patients don't need an account, so that's really important too. They simply click on the clinic link that you've sent them, fill in their details, usually their name and phone number, but you can configure to ask for other fields like their Medicare number, for example, if you want to. So that adds all that flexibility in there. That's up to your clinic and the needs of your service. So they don't need an account, they just need the link. They don't need to be in your contacts, or like, you know, if you were doing it via Teams or something like that, you'd need to have contact, and sometimes you need meeting IDs and things like that. With video call, you don't need anything except the link. And I said before, there's all of our calls are encrypted. No patient or personal health information is stored. That's really important. That's following all government regulations. So we don't keep any patient information or anything they share with you during the call. If you want to, you can obviously, you write down all your patient or caller information into their record or something like that, but nothing is stored on our platform. And we're government funded, so we're free to use for eligible health services and their patients. And this is sort of a more allied health tonight, and there is a program that goes through until June 2022 for eligible services, and I'll show a slide about that in a moment. So we do have the Resource Centre Library, I already mentioned that, and our support team. So you can always get in touch with us 8 a.m, 6 p.m. local time, and we can assist you with anything you need to know or any processes that you need to know about video call. That's just a screen grab of our resource centre. So basically there's a big search bar here. You can type in whatever you like. There's keyword searches all in here, and there are articles, videos. So there's how-to guides, and there's also downloadable, configurable pamphlets, for example, we've got one that's a patient information flyer about their appointment. So you can use those things, you can modify them, use what we've got and create your own if you like, but we're always there to give you a hand. Just a quick by jurisdiction. So we just put this slide together the other day, and I thought I'd share it with you guys today. So just on our platform, we've got 468 organisations. We've got 8,500 clinics on video call, and this just shows the clinic breakdown in terms of the jurisdiction. So the Commonwealth is funding GPs and allied health, so primary health. You can see that currently, now something's happened with my slides. You could see that currently it's 44% of our platform, and that's because also lockdowns, restrictions, all sorts of things going on that have really bumped up the Commonwealth side of things. Often Victoria Health is one of our biggest users, but we're getting a lot of new clinics coming in via the PHNs in primary care. And so you can see the Commonwealth here. This is July 2021. In the Commonwealth, there was 41,638 video calls conducted during July. So that would be GPs, psychologists, other allied health professionals in the primary health space. So there's a lot of people using video call, and obviously since the pandemic, there's been a lot more onboarding. This is a bit of an older slide because I showed this at the last one, but this was just GP clinics, but just to kind of show you, Central and Eastern Sydney PHN was kind of a big slice of the pie here in terms of GP clinics added. So we had, at this was about 3 weeks ago, we'd had 291 clinics added and 47 were CESPHN. Now we've got 10 new GP clinics in that space for your PHN. So we've got, and they can be, I haven't been able to break down whether they are GP practices or allied health. And sometimes there's allied health professionals obviously working in the GP practices. So that was overall in the primary health space. So the total of number of clinics that you've got there in the PHN is 174 and 57 new ones. And there's 403 new service providers. So when you create a clinic, you can add and manage team members in there. And then as you're added, you can create your account and use video call. And since the 1st of July, 11,930 video calls have been conducted in clinics that are associated with CESPHN. So they're pretty good numbers. And obviously during a pandemic, things have lifted considerably. So just the access eligibility, there's the COVID-19 GP access till the 31st of December, December 2021. And what is called the exemplar program, PHN, is for allied health services or non-GP type primary care services. So they're classed as mental health, aged care, maternity, Indigenous health and allied health services. So running, currently funded, so free to use for those services, currently until 30th of June 2022, and then we'll be waiting to hear what the government's going to be doing more longer term. Nerida already mentioned the pivoted towards video. The COVID MBS items for telehealth pivoted towards video from the 1st of July 2021. And I will share this slide pack, and that's got our FAQ page in there as well. So this is just an example of when you come in. So when you send that clinic link, if you perhaps text that clinic link to somebody, this is what they'll get as an SMS. And there's the link. They click on it, put their name and phone number in, and click continue, and they're in the waiting area. And then the service providers in the clinic sign in. That's a picture of our sign in page, and put in their username and their email address and their password, and can see their waiting area and can join their next patient. So it's wholly via the web, and you can use it on everyday devices with a good internet connection there. If you haven't got an account, I'll just go through really quickly because we're not going to cover this later on when we do, or soon when we do a demo. The setup process. So you can either go through the PHN and you can apply to them and they can set you up with a clinic. We can also set people up with clinics as well. We've got an online form. But once your clinic is created, it's the name of your business or your practice or whatever you're setting up there. You give us the name, and you give us the name of an administrator who is going to then be able to add and manage all of the other team members. So this is the first person gets set up. They get an email saying, you know, you've been invited to join this clinic. They create their account, and then they're the administrator for that team. You can have one or more administrators. It's always a good idea to have two, just in case someone's away and you need to add more team members or do something to the waiting area hours. So if the clinic, if you're already set up with video call and you just need an account, then your clinic administrator can add you as a team member. And you'd obviously contact someone who you know is the telehealth manager. You can also contact us. We've got a list in our resource centre of all the various jurisdictions and the names that we've got to put people in contact with, or the email addresses. So once you're invited, this is what you get. Gives you some little links in there to kind of, you know, watch a video to get familiar and create your account. So it's based on your email address that you're invited with, and then you create a password. And then that's what you see. Basically, it's very straightforward. 13 characters or more for security reasons, the password, because, you know, that's part of the government manuals around security. So you fill in your name. When you create your account, you put your name. I've put training as my last name here. That's not very helpful. But anyway, Jude Training is my name there. That's the only thing that callers or patients will see that's personal to you. Basically what they'll see and hear you, but on your screen when you're in a video call, it'll just have your initials down the bottom. If they kind of hover over that, it says your name, and you can put Dr. Smith, or you can put your full name. Nothing else is shared. So they're not going to see your email address or anything like that, obviously. It's extremely secure. You can also integrate the clinic link, and I'll show you where you find the clinic link in a moment, into practice software. So you might create a new, or clinic software where you're sending out patient information. You could create, say, okay, we're going to have an appointment. So create here, this is a template, and what you do is fill in the details that you need to fill in there and add the link. And then that patient or caller can come in at the time of their appointment and arrive in the waiting area. So you can integrate with other clinic software in that way using the clinic link. It's a picture of our sign-in page, which prompts me to go to the actual sign-in page, which is here. So now I'm in a Chrome browser. You can use the Chrome browser, Microsoft Edge, if you're on an iOS device, Apple Safari, or the Firefox browser as well. There is another browser called Opera that hasn't got a huge amount of market share, but that is also supported. Older browsers like Internet Explorer, and, you know, there's a Facebook browser, like there's all different, a Samsung browser, there's all different types of browsers out there that can connect you to the internet, where you can, you know, go around on the internet. They're not all supported, just for their various security reasons. So we've got our preferred browsers that we support. So Chrome and Microsoft Edge are used the most, and Safari for people on iOS devices. So this is our sign-in page, and I'll just put in fact, I'm going to put in a different email today just so that it doesn't take me to my single sign-on. So I put in my email address that I know is associated with my account, and then I'll click on next. If I can't remember my password, I can always reset it here. Click on next, put in my password. I hope I can remember my password, because I have been using single sign-in, so it picks up my work one. And I'm going to log in. So I just clicked on the keep me signed in for today, which will keep me signed in for 8 hours. If I have a period of inactivity on the platform, when I come back, it'll still be signed in. And yes, I did remember my password, so great. Is there anything coming through in any questions at this point, or nothing yet?
Not at the moment. There's no questions yet. So
all right, cool.
Thank you.
No problem. All right, so now I've arrived at a page called My Clinics. I've just signed in. I'm the service provider. I'm about to do some, you know, to join some video calls today. If I've got access to more than one clinic, which may or may not be the case. Some people have just one clinic because they work in one clinic that's using video call. Some people might have two, And if you're working in a hospital or something, some people might have many. So it really depends. If you've got more than one, you'll come to this page where it will list your clinics. I've got 35 under this particular sign-in that I've used. It lists my clinics and it shows me across the top anything going on. Actually, Nerida, I might get you to come in using that link.
Yep, sure.
If that's okay. So Nerida, is there. Right. She was ready to go.
Yeah, so, yeah, I was ready.
So it tells me there's one caller waiting in one of my clinics, and it will push that clinic up to the top. Because this is a training organisation, there's nothing else going on. No one else is using it at the moment. So as I said, I'll come to the My Clinics page if I've got more than one clinic associated with my account. Otherwise, I'll go straight into my clinic waiting area. So I'll just choose this one. And this is the clinic waiting area. And there's Nerida, who is coming in as a caller and ready to be joined by her service provider when they're ready. So this is what we call the waiting area dashboard, and the management console is what it was called in that other slide. So basically, this is where you arrive, and this is your waiting area, your virtual waiting area. This is where patients, callers, clients are seen. And you can see that using the clinic link, Nerida's come in, put her name, phone number, and that's just in case, I need to call her. That'll only be here while she's either waiting or on hold or being seen. As soon as the call ends, all of that information will be purged. And then there's the really important join call. That's the main call to action on this page. If Nerida is my next patient or caller, I would join the call with her and start the video call. I'll just quickly show on the right-hand side, I won't go through everything here. You can do a pre-call test just to kind of test your network and equipment, usually for the first time when you're using video call on a particular network and with a particular computer. After that, once you know it's all working and everything's fine, you don't need to keep doing test calls. It's just if anything changes. You can get waiting area alerts. This is optional. It just alerts you whenever a caller comes in to the waiting area, and you can get them via SMS, email, or desktop. So you kind of just go in here, put your phone number in, and either turn this on or off. And then this is just 5 minutes after this person comes in, I would get, or actually after each person comes in, I would get an SMS, which I will get probably in about 3.5 minutes on my phone. So I'll click save and it tells me that it's updated.
So Jude,
yep.
Just to interrupt, I apologize. And I'm sure you probably will mention this, but yeah, maybe just for anyone who's going to put those alerts on, I would just say, just keep in mind that it is for, as Jude just said, it's for any person that comes in. It's not practitioner specific. We've had a few doctors going, why am I getting text messages for my colleagues, patients, or something like that?
Yeah. Yes. Video call doesn't know who your patients are. It knows everyone who's coming into this waiting area, just as if it's a physical clinic. Maybe you've got 5 service providers in that clinic. I go up, I walk in, I go up to the reception, so I'm here to see Dr. blah, blah. And then I wait, I take my seat, and then I'm called in when they're ready. It's the same concept. So it's not your own waiting area just for you. This is for the clinic. It's called Acme Cardiology. It could be called, Green Street Physiotherapy, or whatever it is, the name of the service that you're working with. All of the service providers that are added here, and there may be one or there may be more than one, there may be 5 or 6, there may be many, can all see everyone coming in. And then you use your usual booking software to know who your next patient is, and you find them here, and then you join the call with them. So yes, in our resource centre, I've recently just updated it to kind of say, look, if you're in a really busy clinic with lots of people coming in, video call does not know who your patients are, because remember, we don't keep any patient information. And so it'll just send you an alert every time somebody comes in. So sometimes people do then go, oh, actually, I think I'll turn it off. It really is there just to alert you in case you're away from your computer and somebody comes in, but it works really well in smaller clinics when there's only one or a few service providers. But yes, you can choose to have that on or not. So this is my account. Oh, there goes my mouse. Oh, my magic mouse has just gone crazy. This is my account. I'm setting this alert for just my account. Other service providers in this clinic could also set alerts for their phone. So you control your own account, and always put your own phone number in there. That's another thing that has happened recently, where somebody else, I think they were just trying to figure out what they were doing, and they put somebody else's phone number in there. So that person kept getting alerts every time someone came in. So I did manage to track down who that was, and we took it out. But this is for your contact, so that people, so that you know when someone's coming in. So there's SMS alerts, there's email. You can turn it, put your email address in here, turn it on. You can set a call alert delay there as well, or you can get desktop alerts, which will just bring up a little badge up here saying someone's in your waiting area, and it will make a little bell sound. So they are completely optional. You don't have to use them. It shows you the waiting area hours, but you can only view them from here and just see what they are. Your clinic administrator, however, can go into the configuration options and change those if required. So the really important thing I just want to show here is this is the link to the waiting area that I was talking about before. So this is what all of the callers who are going to come in here and have a consultation need, this link. So this has got Acme Cardiology, that's the name of the clinic. You can either copy the link. So if I copy this, it'll say copied, and I can paste that into perhaps a receptionist email and type in, the other information, like you'll be having a video call on the, the who with, what time, what date. And at the end, I would copy the link so they've got the link. And it's really great to send this out in electronic form. Some health services still use paper letters, and that's fine, but it just means the person has to type it in. And what sometimes happens when they're long clinic names that haven't been shortened before this is a URL, so a web link has been sent out, is they have to type it all in. If they make any mistakes, they don't get to the right spot. So it's really great to send it to them either via email or SMS wherever possible. And if you know they're going to be using their phone, then SMS is fantastic. They just tap on it. But you can usually get, obviously, your emails on your phone as well. So you can copy the link and then paste that somewhere. Or you can send it directly from the platform as well. So if you click on send an email or SMS, you'd put in their email address if it's an email. You can change the subject and the invitation message. You can type something else in there, or you can have a little template ready and put it in. And it will, at the end of that email, send the clinic link as well. It'll have that as part of the body of the email. Also send SMS, same sort of thing, put their phone number in. You can edit any of this. Now, what it always does though, once I've sent this one and close the box, it'll send that to the person. But when I open it up again, perhaps to send it to the next person, it'll still have that same default text. It doesn't remember what you last wrote in there. So we've got some templates on our resource centre that you can keep in a handy spot and just paste in there. So that's how you can send it directly from the platform, or as I said before, you can copy the link. I'll just copy the link now and just show you what it looks like. So I copied the link. Let's just pretend I'm now the client and I've received an email and I click on the link. So when I click on the link, I'll just paste it in here. It looks like this. So this is where I go to if I am client patient. I don't need an account. If they get to the account page, then they've been sent the wrong link perhaps. They don't need to have a login. They don't need to know your details or anything like that. So they just go to start video call. They can always run a pre-call test, like a test call as well, to make sure their equipment's working well. But this is what they do 5 to 10 minutes before their appointment. They click on start video call. So there's a little picture of them in here, and that just shows them, A, that their camera's working, and it also keeps the page open while they're waiting so it doesn't go to sleep. So let's just put in a name in here. And it tells me that my phone number is required. And I can read any of these terms of use or anything like that. So as the patient, I can choose to do that, and I'll click continue. they always go to there's usually an important information, clinic information field that the clinic administrator can fill out. This is our default text, but you can change this to be anything you want the person to read before they come into the call. And then when they click continue, they're now waiting. And I'll just turn off that lovely hold music. So I'm basically waiting now, and it says you are now waiting to be seen. If I've got more than one camera and it's not showing the right one, I can switch the camera. That's only if you've got more than one and perhaps it was showing the front instead of back camera or whatever. And you can change they can change the music while they're waiting. So now I'm waiting to be seen. So just as I would in a physical clinic, I'm now going to wait until my service provider is ready. You can send messages to people while they're in here. If I go back, so importantly, I've got 2 tabs here with video call now. So when I join, when I join a call, I will be able to still always get back to here. So sorry, I'm waiting here now. So I'm the patient, but here I'm the signed in service provider. And now I can see that Sue's here and Nerida. So I'll just show you how you can manually notify someone. You can also set up automatic notifications. I won't go through all of that now, but you can kind of say, you know, hi Sue, the doctor, or if it's a doctor, is running, say 20 minutes late. And I could say, please continue to hold or whatever. If I send that, it kind of tells me that I've sent this person a notification by a little 1 there. If I go back to being the patient again, it tells me here. And there's an automatic one that came up because that's configured in this clinic. But so you can actually get in touch with people and just let them know what's going on so they know, oh, okay, that's fine. I'll just continue to wait. So that is the waiting screen. And you're in there twice. Nerida.
I don't know why. I don't think
I thought you'd come in again. Okay, maybe.
I did sort of go out and in, but I thought I went anyway. I'm not sure what. I didn't fill it in again. Not sure what happened there.
All right. That's fine. It's probably, and because I'm doing some weird things on my computer here as well, if I just refresh. So I'm going to look, and it tells you how long people have been waiting for here as well. So you can get information from down here, but I won't go through that now because we will run out of time. I just want to show you the basics. So what I'm going to do is join that call. So I'd have a look and I'd say, Nerida's my next patient or client. There she is, and I can join the call. So this is the join call button. And in this clinic, and it's a really good idea to enable this, the clinic administrator can enable it. We've got a little confirmation that comes up. It's optional. You don't have to have a confirmation. If you don't have it, the call will just open and the call will start. It's just letting me know who I've clicked on. And in a really busy clinic with lots of people, perhaps it's, you know, it's great to have this because you can go, yep, that's who I meant to click on, and I will then join. This opens up the call screen in a new tab or a new page. So there I am. And now I'm just waiting for Nerida. Have you got any low bandwidth or anything going on there, Nerida?
No, but it also just says I'm waiting to be seen. So I'm wondering if I'm on the wrong wrong one. Hang on, let me see if there's another one open.
Oh, you might have a couple of tabs.
Doesn't look like it, but
okay. Well, what I can do, if that's because it's come in a couple of times, what I might do is I'll just close that up. Can you just come in again?
Just, yeah, sure. I can leave, like go out altogether. Yep.
Yeah, go out altogether and come in. It's probably also because we're doing this from within Zoom. So we're trying to do a lot of things while we're sharing a screen as well. We'll just see how we go. So we're doing this inside a Zoom session, which is also streaming video. So I'll just let Nerida come back in again. If there are any questions, I can answer something while we're just...
Yes, we do have a question.
Mm-hmm.
Is there a time limit opportunity for either a long or standard consultation? I'm assuming that means, like, you know, is there any sort of time limit set up? Yeah, I'm not sure. Is that a question like you would like to have time limits put on it so that you can sort of keep a track of what you're up to and so not accidentally go over, or is it more just can you have an unlimited
Is there a time?
consultation?
Yeah.
I guess maybe if we can answer both of those, I don't know.
Yeah, look, you can have there isn't a time limit on the consultations. Once the call is going, you can keep going in the call until you end that call or transfer it somewhere else if that's appropriate. But yes, there isn't a way of kind of setting up a timer or anything within the video call platform to say, I want this call to only go for 10 minutes or something like that.
Yeah, okay. So it was clarified that it was, is it an unlimited thing? So yeah, absolutely.
Yes. Absolutely. All right, let's give this another go. I'm going to join the call with Nerida.
Do you want me to mute on Zoom or?
Maybe just mute in video call.
Okay.
Okay, there's something weird going on there. There we go. So I think there's a bit of bandwidth stuff, but it's also, there we both are. It's also because where both of our computers are also participating in a Zoom stream. So we're streaming video twice. And I'm working from home. We probably mostly all are. A lot of people are, and so it's our bandwidth here while we're also doing a Zoom. So you wouldn't normally be doing that yourself. So there we are, and in my screen here, I'm the service provider. I'm the one who signed in. Nerida came in as a client and I have joined her. So I'm on the smaller screen here. You always see yourself a little bit smaller as a default. You can, if you want to, you can, click and you can make them the same size, but you're normally not really wanting to look at yourself as much. You can minimize yourself completely as well, but I'll go through that if we have time. So at its simplest, this is the video call happening and we would be chatting to one another, but it's probably not appropriate to do that now because we're also chatting to one another in Zoom. So
yes, it gets a bit complicated.
So you can see that. And I don't know whether when we're sharing the screen, what it looks like for people, whether the video looks a bit stilted or something, but that's because once again, we're sharing in Zoom as well. But it may look fine. I'm just not sure at your end. Okay, so this is our video call. We have our conversation, we have our consultation, and then we could end the call. But we do have lots of other things. How am I going for time? How much time do I have?
We're at 7:40, so we've still got a bit of time yet.
Okay, I'll just show a couple of the tools and a couple of things about how to add somebody else into the call, and then we can stop for questions. All right, so tools up the top here, that is where you will find your usual screen share. You can add a whiteboard so you can draw diagrams and your clients or patients can also join in on that as well. You can share an image or a PDF that could be an X-ray or a report or something that you actually want them to download. Like you could share a file. Perhaps it's if you're not doing an electronic prescription and you've got a script that's in a PDF form, you could share that. They can download it. So you can do that sort of thing in video as well, in video call as well. I'll just share something, probably the same one I did last time. And what I do is it takes me to my computer to say, what would you like to share into this call? So I'll do this one because it looks kind of cool. So there we've got, say, an X-ray, and you can everyone can see that in the call. So you can have up to 6 participants in a video call. Currently, we've just got the 2, but everyone who was in the call would be able to see this. And then I can, annotate over the top. I've got this little toolbar up here. I can pretend that she's done something here to her finger. And you can type, you can do all sorts of things. As you can see here, you can type. You can have a look at that if you've got access to video call. And so you can annotate over the top. The other person can as well, as long as you don't restrict them from doing that, and I'll show you how to do that. And then you can also download. So they could download this at their end for their information. And you can do that with most of the tools that you can take either a screenshot from within video call or download it. If this is something that was shared with you as a clinician, you could download this and put it into their record, but you'd be responsible for kind of making sure that was stored securely, so it would go straight into their patient record or something like that. So you've got tools here. You can see that I've got a little one here. It's going to, if I click on that, it shows me my available active tools. And I've only clicked on one, so there's just one. I'll just quickly do, I'll add a whiteboard. So now there's two, and I can click between them. I never know what to draw when I get to this. Oops, I've still got the highlighter. So I always try and draw, so it's pretending this is a knee, but really it doesn't look like it. You know, something. I know that some clinicians like to, you know, it's handy to be able to draw a diagram. The other person can interact with this as well. And once again, it can be downloaded. Either the original, in this case, it's a whiteboard, so there is no original, it's with the annotations. And you would save, and that would save to wherever the person's downloads go to. If I go here and go, it'll say, do you want to save the original, which is the X-ray, or do you want to save it with the annotations that they drew over the top? So you can decide, click save, and it'll go wherever the downloads go to. So having said that, you can have a little play. That's where the tools are. Make tools view only for guests. If you don't want them to be able to interact with them and you just want your client to be able to view it and not, you know, annotate over the top of it if required and not be able to download via this toolbar, you can click that and then they wouldn't be able to do it. So that's just there, just if you know, if required, just an option. You can also, there's a little chat, you can type something in here, maybe there's a link or something that you'd like them to click on, or a difficult to spell medicine name, you could type that in and you can have a chat, but obviously you're talking to them as well. So, you know, it's up to you. And there's also the call manager. So just with that, I'll just close this up. When I'm in and I've been sharing some tools, I could choose to remove out of the call, and then it says, are you sure you want to remove this? I say, yes, I want to remove it. But what you can also do is just, you can leave them there if you want, and you can just close it up with the little close document, because it's going to leave and be purged from the call at the end anyway. That nothing, there's no footprint with that. So it's up to you, but you can just kind of click on the X. So I did mention you can have more people in a video call. So there's a couple of ways to get them in. The first way, if you're actually already in a call, you can invite somebody directly into this call. So not into the waiting area and wait, but directly into this call using this call manager, this little meeting call manager thing. It tells you who the current participants are, but you can invite a participant in. So this is a secure video room that we're in, and the only people that can get in here are people that I either invite in or go and add to the call from the waiting area, which I'll show you in a moment. So say we had a specialist that we'd let know that they were going to come in, and I'll say, look, I'll send you an invitation when I'm in the call with Nerida. So I'd click, put their name in. Once again, email address, you can change this text or SMS. You can send them an SMS and you can invite them into the call. Once you put in their phone number, it'll come up with invite here. Invite them into the call. So once I've invited somebody into the call, as soon as they click on that invitation and click on the link, they'll come straight into the call, and there would be 3 people. I won't do that now. I'm not going to invite anybody else into the call at the moment, but you can do that. And they would be here, and then there would be 3 participants in the call.
But so yeah, that's also, where we can, sorry, Jude.
Yeah, carry on.
I'm talking on my own little thing here. And sorry, it's a bit bouncy. I'm actually on my phone. I'm trying to hold it very steady, but it's,
yeah, it is a bit bouncy.
It's a little bit bouncy. I think my arm's getting sore. I'm holding it out as far away as I can.
Can you lean it on something?
Yeah, probably I could, but anyway.
Yeah.
Yeah, I was just going to say interpreter. You could have an interpreter join the call as well, potentially.
Yes. Yeah, so you could either, if you've got their details directly, you can get them to come into the call by inviting them, or you can go back to the dashboard and add them to the call. So this is the call screen that opened when I clicked on join call. And if I go back, I can still go back and forth. So some people don't realize that there is still your waiting area open in a tab, and I can go between them. So here I am, and I'm back in the waiting area, and it shows me, Nerida now says my call because I'm in a call, and it says 2 participants and being seen. And Sue is still waiting with 1 participant. But importantly, her join call button has changed to add to call for me in my account because I'm in a call. So as soon as you're in a call, if there's other people waiting in the waiting area, all of their buttons will change to add to call, just in case that's what you need to do. So if Sue was an interpreter or a carer or somebody else who needed to come into this call, I could be in this call, say to Nerida, I'm just going to go back to the waiting area and grab the interpreter or whoever it is. Add to call. As soon as I add them to the call, they will appear in the call and there'll be 3 people in the call. But that's the only way they can get in, either invited straight in or add to the call. Because it's peer-to-peer and there's no kind of meeting link sent through emails or things like that. It's basically just it's a link, and the underlying technology, which is WebRTC technology, if for people that know what that is, you don't need to know what it is. It's a very secure way of sending video and the audio via the web. And we're having a peer-to-peer connection now, which just means my browser is going straight through to Nerida's browser. So you can't sort of bomb in to sessions. You know, you probably heard about Zoom bombing, and I've certainly had it happen to me when I've been partaking in Zoom conversations where somebody comes in and it's like, whoa, we don't know who that person is. So that's the secure side. So just remember, you can go back and forth and you can add to the call. If there was other people here, perhaps there's somebody else you need to add to the call. So now I'll just come back. I won't add anyone to the call now. I'll come back in here. I'll just close that up. And you can lock a call. I'll just quickly do that. So that's just, if this is enabled in your clinic, you can lock it and it says this call is now locked. All that means is back in the waiting area. Now it says locked call. So for everybody else who's signed in, they would see all these, if they're not currently in a call, they would see everything as join call, but they'd see this one grayed out. They couldn't accidentally click on it and join. So that's what that is. It stops people coming in from the waiting area, but I can still invite people in if I want to. So that's locking the call. And then the other one I was going to show you is the hang up button. But before I do the hang up button, are there any questions relating to the call screen?
There's a couple of questions, but they're not about the call screen as such.
Okay, so I'll just do that then, and then we can talk. So hang up, a couple of options. You can either leave the call, which is only you leaving, or you can end the call. So if you've had a consultation with someone and it's ended, most of the time you'll end the call. It will end for you and it will end for the other person as well. If you wanted to leave the call and you're in a call with just one person, if you leave, it will put them on hold in the waiting area and their status over here would become on hold, and perhaps a receptionist is going to join them and book another appointment or something, or take payment or whatever it is. So if you leave the call with one other person in it, they will go on hold. If you leave a call with, say, 4 people in it, the call will continue with the other 3 people to have the conversation and the call, and then it'll keep going until somebody ends it. So you can, it depends on your workflow and what you're doing. So I might end the call for everybody, and then it will say my session has finished, and it will say that at the other end as well. And then I'd be ready. I can just close up that window and I can go and join my next patient. So that's probably enough of me chatting away.
Yeah, we've filled a fair bit of time there. So thank you, Jude. And we have got a few questions. So the first question that we've got is from one of our participants, just saying that their desktop computers in the surgery don't have a microphone and a video camera. And is that a difficult thing to install? Now, I mean, that's not necessarily a Healthdirect question, I guess, but and we can help to some extent with from the digital health team. We don't provide those or anything like that, but look, it's my understanding that no, it's not difficult to install. It's not overly expensive at the moment to buy, depending on, you know, what top of the line or not so top of the line that you want to get, but you can get just a webcam with a microphone included in it, and it's reasonably easy to have that installed by your IT people who normally supply you, or if you don't have an IT team as such, or you don't have that available, it's probably quite easy for you to do yourself, and that's obviously for a desktop. If you've got a laptop or a I don't know, any other device, they usually have a camera and a microphone installed.
Yeah, that's right. And just while you were talking then, I've just gone to our resource centre and typed in equipment, and we've got some things, you know, recommendations. But this is the one that I've got at the moment, a Logitech, and it's got a little microphone in it and a camera. And I think they might be $80. They're not very expensive.
Yeah, I mean, I know that very early on in the pandemic, so when, you know, sort of March, April last year, it was very hard to get a webcam.
Yeah.
Everything was sold out. It was like toilet paper.
Yeah, that was crazy.
But now, as far as I know, you know, you can get them kind of wherever, JB Hi-Fi and Officeworks and your normal IT supplier and your, I'm assuming wherever, Harvey Norman, I don't know, wherever you want to go to, you'd be more than likely to be able to get them. So that shouldn't be too difficult. It just depends on your own, you know, what you wish to have installed or whatever. There's another question here about a template for patient consent, a template patient consent document or a procedure for consultation with new clients. So what I would potentially say for that is I might have to take that one on notice. I don't know if our practice support team provides such a document. I don't know if you have anything like that, Jude, but I mean, we certainly have been recommending to anyone who's going to use any type of telehealth, whether it's telephone or video, that you would be looking at, you know, you have a policy in place for your clinic or for your practice or whatever. Obviously, you're still going to have your documentation in whatever type of patient notes you normally would take. So that might be, I don't know, in your software, your best practice, your medical director, if you're using allied health specific software, wherever you normally take your notes, we're saying, you know, still do that. And that would be where I would say, you know, you initially document, spoke to Nerida, saw Nerida, you know, explained to her this is a telephone or a video consultation. She consents to that. But yeah, I can certainly find out if we have anything more specific around a template. But yeah, I don't know if you have anything else like that, Jude, available?
No, not for that. So we basically say to people, look, if they've got their own documents, what we're working on is, so currently during a video call, you can share things and people can download them and fill them in or whatever, but we're working on online forms and consent forms in particular that perhaps come up while people are waiting as well. And that is in the works. So we're just working through all the security and the technical details around how to provide those, but that kind of relies on people having the forms themselves. And we can certainly, you know, come up with ideas for templates, but it's probably quite unique to each service as to what they would want.
Yeah, absolutely.
So, yeah,
so I agree. And I mean, the thing is, of course, if you decide in the midst of your consultation that you do actually need to see this person to make a proper clinical diagnosis or whatever, then that will come into that consultation. And again, certainly for GPs, you can say, right, well, actually, I need to see you and you need to come in and you need to do whatever. And I'm assuming the same would apply for any allied health or any consultation, that you would just say, look, I do need to, whatever it might be, examine that, feel that joint or do whatever, and then sort of arrange that with the patient while you're there. So but yeah, I will look to see what else we have available as well. And I think that'd be great, actually, Jude, if there are online forms at a future point where it could be sort of something like that. There's a question here about, do other people who are waiting in, so the patients in the waiting room, do they see the names of the other patients who are waiting?
No, it's as I say, look, it's extremely secure. All they see is this: I'm waiting. And all I see, any messages that are being sent to me, the name of the clinic that I'm waiting in, and that's it, and the playlist to play any music. They don't see anything. And as I said, so in terms of security, like the signed in people, so the people who are the team members of this clinic, so it might be, maybe it's a psychology clinic, whatever it is, would see the people coming in, they'd be able to see the names. Nobody else can see those names, only the signed in people who have an account with video call, and they would just join their own patients. So, and then they can lock that call if they're worried that one of their colleagues might click on the wrong join call button. If there's a few of them in here, then as I did before, they can lock it so it grays it out. So, and the only thing, remember, that they see of you is the name that you've put in that's associated with your account. So it's just your
Yes.
name. They don't see your email or anything like that. That's just what you sign in with and how we recognise you in terms of having an account with video call.
Absolutely. And I will just probably mention too, we have had a couple of practices, they just set up a single sign-in that they had for, I don't know, admin at the practice. And they then were a bit confused when different doctors were logging in as that and then trying to see different patients that didn't work. And as Jude said, when you're seeing a patient, that's the only patient you can see. You could add more people to that call, but you can't run 5 different calls at the same time. So just make sure that any clinician who's going to use this has their own individual login to be able to see their patients, and they can have unlimited, can't they, Jude? There's no like, if you've got a clinic, you can invite 20 people, 50 people, whatever.
Yeah, so let's have a look at what we've got in this one. Well, they're mostly me because I'm doing a lot of this stuff, but there's different email addresses in here. But this is where you add your team members. So yes, if you've got, some people have a reception at, you know, whatever clinic it is, or admin at, and sometimes the reception staff say rotate and they all use that, but they're not actually joining a call with patients. They're kind of having a look and just seeing who's there, and perhaps they're sending the messages if the clinician's running late, say. But if you're actually seeing people and joining a call with people, your account means that you can join, and if someone else in the next room has used the account, you can't be, it'll say you're already in a call basically because someone else is using that account. So generic accounts aren't great from that point of view. Also, when you create your account and you put your name in, that's what they see. So you don't want them to see admin at you know, in the call screen there. So it is really, and it's really quick and easy to set everybody up. They just need to use an email address to sign up and create a password. They can use a personal email or a work email address. Video call doesn't mind as long as they know which email address to sign in with once they've created their account.
Absolutely. There's also just a question about, is there any limitation in functionality or any difference if a patient uses an iPhone or an iPad or whatever device the patient might use to log in, sorry, not log in, but join the call. And presumably that would also apply to, does it make any difference for the practitioner if they're on a desktop or on their phone or wherever?
No. So video call is device agnostic, so it doesn't matter. The only difference would be, say, if you're looking at the waiting area on a phone, it's going to look smaller and the join call button will be smaller, but it fits, you know, to go to the screen. So a lot of places do use iPads or some kind of tablet, especially if they've got older desktops. Some places, if they've got desktops that haven't got a microphone and camera, some places are investing in doing the video calls on tablets, for example. But you can use any, and as I said, you can use the 4G if you're on a phone, or you can connect to the Wi-Fi. So really, as long as you can have a video connection and a browser, then and as long as you've got on that device a microphone and a camera, which, as you were saying, Nerida, laptops and devices like a phone or a tablet do have those built in, then you're fine. And you don't have to, I sometimes get calls from people saying, I'm working from home now, how do I get it on my computer? Like, what do I need to download? Really, all you've got to do is go to the sign-in screen and sign in from that computer or that tablet. You can do it from any device, as long as you have the sign-in screen. You know, vcc.healthdirect.org.au. And if you save it as a favorite in your, say you're using Chrome like I am, if I go to another computer and I'm signed into Chrome, it's going to be one of my favorites still.
I will say, just as a patient, as you saw when I signed in on the phone, like when I joined on the phone, that's the only thing is that, yeah, you got to keep your arm, like your face looks really big, unless your arm's really long. But yes, when you said prop it up against something, that made a lot of sense. And then I did, and then it was much less jumpy and bumpy. So probably worth saying that to patients too.
Yeah, and that's the whole telehealth side of things. Apart from Healthdirect video call, like whatever you're using, whatever telehealth platform you would be using, there's just all that kind of stuff around the best way to use and to participate in a call as well.
Absolutely. And a very important question about, are the SMS costs covered by the service or by the practice?
When you're sending it from here?
Yes.
by the service. There's no cost. Healthdirect video call is 100% government funded, and we don't take payment for anything. We're not for profit. So no, you don't pay.
So yes, that's always, and we do get that question quite
and
often.
Fair enough. I should have mentioned that. I went,
No,
yes, because it is
I forget
SMS.
too. But yeah. So yeah, there's no cost obviously for SMS. Obviously there's no cost anyway with email, but there's no cost with that one. So I think that's pretty much our time. Does anyone have, I mean, if people have more questions though, you're most welcome to ask them. I think hopefully we've covered most of what you need to hear about. And if you do, of course, have other questions, even if you think of them later on, please just contact us at CESPHN at that email I had up earlier, which is just telehealth at CESPHN, so CES, Central Eastern Sydney, phn.com.au, and we can arrange, whatever questions you might have around it, or if you want to know a bit more information. I think Bertha from our CPD team has very kindly, or she just put the telehealth email up as well, but there's also the help resource page there for Healthdirect, which is really good. There's some really great resources. There's some good videos, short videos of how to use it as a clinician, how to maybe, if you want admin to do specific things, get them, sorted out to how to do their part of it or whatever. So again, if you're going, oh, I'm not sure, well, should I get this, not, whatever, have a look at it again if you want any more information on there. But certainly if you are interested, if you don't already have one of these clinics for a Healthdirect video call clinic, please just, get in contact with us. It's quite quick for me to set them up. It's quick as well from Healthdirect side. So whoever you contact,
that's
usually
right,
gets it done in the day, and we have you set up then and ready to go. And it's like, as Jude's been saying, there's no downloads, there's no anything you need. It if you've got the camera in place, the minute your clinic is set up, you can start your consults 5 minutes after that, whatever. There's no kind of waiting or having to get anything set up. So thank you for everyone who joined. We haven't had any extra questions there, so we appreciate you taking the time to join us tonight, and please do fill in our evaluation, which will come up shortly. Like I said, we would definitely take notice of that, so thank you very much, and get in contact if you need any other help. So thanks a lot, Jude, and thanks everyone else.
Thanks everyone.